Question. A client with chronic heart failure is newly prescribed digoxin. Morning labs reveal potassium 3.0 milliequivalent per liter, magnesium 1.5 milligrams per deciliter, creatinine 2.1 milligrams per deciliter, and an apical pulse of 64 bpm. The client reports nausea and blurred vision. What is the nurse's priority action? A. Hold digoxin and notify the provider of the findings. B. Administer digoxin with food to reduce gastrointestinal side effects. C. Encourage intake of potassium and magnesium-rich foods before medication. D. Document findings and recheck the apical pulse in 1 hour. Answer. A. Hold digoxin and notify the provider of the findings. Rationale. This client is at high risk for digoxin toxicity because of hypokalemia, potassium ion 3.0 milliequivalent per liter, and hypomagnesemia, magnesium 1.5 milligrams per deciliter, both of which potentiate digoxin's toxic effects. Elevated creatinine 2.1 milligrams per deciliter, which suggests impaired renal function and decreased clearance of digoxin. Clinical symptoms: nausea, blurred vision, which are early signs of digoxin toxicity. The nurse must hold the medication and notify the provider immediately for further management, which may include electrolyte replacement, digoxin level monitoring, or adjustment of therapy. Simply checking the pulse or encouraging diet changes is unsafe because a client already exhibits toxicity. Administering the medication would be harmful.